Hi, hello, good morning, friends. Welcome to our channel, The Voice of Nurse. Today, we are going to discuss a new beginning from the nursing subjects first aid topic. We are going to take a first aid introduction, procedures and techniques in first aid in emergencies and community emergencies, and community resources. Related to these topics, we will cover in first aid. FAQs. Till now we finished NHM 2022 two sets. Recent January 2023 NHM paper also we discussed. Regarding the subjects nutrition, midwifery, anatomy and physiology, nursing foundation, mental health nursing and medical surgical nursing, and last finally we discussed one model paper related to the previous years. We already discussed these many subjects and questions and answers related to the subjects. I already mentioned in the playlist these many subjects I already arranged in playlist. Just check it once, friends. Before moving on to topic, a small request, friends. Anybody watching first time my channel, please subscribe my channel, click on the bell icon for further notification. Share the video to your friends and please give a like and share your opinion in comment section. Let's move on to topic. Today we are going to discuss a first aid related to the emergencies. Basics of first aid and related to the skills and management we are going to discuss now. Introduction. Not only CPR, we are having so many emergencies condition related to the first aid, but now we will discuss CPR related to the introduction and some of the brief related to the CPR. Now we are going to discuss introduction of the CPR, definition, purposes, indications, types of CPR and procedure. Definition. When you provide medical care to someone experiencing sudden injury or illness is known as first aid. So here someone is experiencing sudden injury or illness. That time we have to provide immediately a medical care, that is called as first aid. Next we will see here purpose. We are having three purposes here: to preserve a person's life, prevent further harm and promote recovery. So here we have to preserve person life and further harm you have to prevent and promote recovery. These all are the purposes of CPR. Another definition and purposes are there. Here we can see here CPR is a basic emergency procedure for life support consisting for artificial respiration and external cardiac massage. Purposes like establish effective ventilation and circulation to prevent irreversible brain damage, to prevent mortality rate. We will see indication. CPR indication. We are having two types of indication related to the CPR: respiratory arrest resulting from CPRs and cardiac arrests. First we will see respiratory arrest resulting from CPR. These all are the condition: drowning, stroke, foreign body, drug overdose, smoke inhalation, suffocation, myocardial infarction, coma of any cause leading to airway obstruction. These all are the comes under respiratory arrest resulting from the cardiopulmonary resuscitation. Second one is cardiac arrest related to the CPR. Cardiac arrest related to the CPR: sudden and complete loss of cardiac function, sudden collapse with loss of consciousness and pulse absent in femoral and carotid. There is no respiratory. These all are the indications when we have to give CPR to the someone or victim. That time we have to perform CPR. Here we can see in this picture indications: drowning, stroke, drug overdose, suffocation, myocardial infarction and suffocation we can see in this screen, and also we are having in cardiac arrest situation also we have to perform a CPR. What are the aims? To ensure open airway, adequate ventilation, to maintain circulation until help comes, and treat with ALS can be administered. ALS means, here the word ALS means advanced life support. Next we will see types of CPR. We are having basic life support BLS, advanced life support ALS. First we will see BLS. BLS, basic life support, is the sequence of procedures performed to restore the circulation of oxygenated blood after sudden pulmonary and or cardiac arrest. Chest compressions and pulmonary ventilation performed by anyone done who knows how to do it anywhere immediately without any other equipment we have to start a CPR and immediately. Next, second type is ALS. ALS means advanced life support. Airway secured with advanced technology. Breathing is maintained with some of breathing apparatus. Circulation is maintained by BLS. Circulation is maintained by basic life support along with IV access and defibrillator and also appropriate drugs. So here advanced life support means we have to provide support through the advanced techniques, like breathing is maintained with some of the breathing operators. Circulation is maintained by basic life support along with IV access, defibrillator and appropriate drugs. Advanced life support, we have to follow CAB. CPR is easy as CAB. Compressions, airway, breathing. Compression followed by airway, airway followed by breathing. CAB we have to follow in advanced life support. Note: if CPR is not given within 4 to 6 minutes, death may occur. So, if any person or victim is unresponsive, we have to check pulse. Then and there only we have to start CPR. No need of waiting for third person. Before 10 seconds, we have to check a pulse. Then we have to know whether pulse is there or not. Then there is no pulse, we have to start a compressions. First aid kit. What will come under the first aid kit? Common items like thermometer, antiseptic solution, bandages, cotton wool, gauze, gloves, hand sanitizer, saline, ice pack, PPE, personal protective equipment, surgical mask, alcohol swabs, syringes, torch, scissors, tweezer, goggles, pocket mask, etc. We are having medications in first aid kit. What will come? We will see now. Here medications included aspirin, diphenhydramine, painkillers, paracetamol, antidiarrheal drugs and antihistamines. In first aid, not only these equipments, not only these medicines, we are having additionally so many things, but I am explaining in briefly the role of first aider. The role of first aider have to do, remember PACT, PACT. What we have to remember? PACT. P for protect, A for assess, C for care, T for transport and triage. So, protect, assess, care, transport and triage. We have to remember. The first aider have to remember the role of first aider. PACT. Next we will discuss in briefly CPR procedure. We had to follow advanced life support like CAB, compressions, airway, breathing. Now we will discuss related to chest compression. Chest compression, the rhythmic application of pressure over the lower half of the sternum. Kneel as close to the side of the victim's chest as soon as possible. Place the heel of one hand in the center of victim's chest between the nipples. Place the other hand on top of the first one and interlock the fingers and the fingers of both hands directed away from rescuer. This procedure till now we discussed related to the chest compression in adult, not in children, not in infants. In children's we have to follow with one hand. In infants, we have to do CPR with two fingers, index and middle finger. So, it is different in adult, children's and infant. What is chest compressions? We will see now. Chest compression ratio is rate should be 100 compressions per minute with a compression depth of 1.5 inch. The ratio should 30 compressions, 2 ventilations, compression rate 100 compressions per minute, compression depth in adult 5 cm, in children 4 cm, in neonate 3 cm. CAB, chest compressions has finished. Next, CAB. A means airway. We will see now. Assess for any visible obstruction in the airway. Clean airway by removing any loose obstruction like mucus, blood, foreign body from mouth and pharynx. In case of unconscious victim, tongue is most common cause of airway obstruction. If the victim is still not breathing, then open airway by head tilt and chin lift or jaw thrust method. Note: If the victim is still not breathing, then open airway by head tilt and chin lift or jaw thrust. But it is suspended patients with spinal injury and used a supine position. If the victim is still not breathing on in his own after the airway, then have to assist him breathing. In CAB, we already finished chest compression, airway. Now assess breathing, third one. Now we will see assess breathing. Look, listen, feel, place ear over the victim's mouth and nose, looking towards the victim's chest and stomach. Watch to see if victim chest raising or not. Pinch the nostrils closed with the thumb and index fingers of the hand that is on the forehead. Take deep breath, open mouth wide, place it outside of the victim's mouth, making tight seal 2 full breaths each breath over 1 second, allowing the victim's lung to relax. While assessing the breathing, we have to maintain these things. Note here, avoid rapid or forceful breathing. Rate should be 10 to 12 breaths per minute. Continue the cycle of 30:2 rescue breaths and 30 means here 30 compressions and 2 rescue breaths until spontaneous circulation or until the arrival of medical help. We have to continue same procedure like 30 compressions and 2 rescue breaths. This procedure means the CPR procedure we have to continue until the spontaneous circulation or until the medical team arrival. Next, guidelines termination of resuscitation. When we have to stop a CPR, return of spontaneous circulation, arrival of rescue team or medical help, and death is confirmed. So here these are the guidelines for termination of resuscitation. Here we can see in this picture head tilt and chin lift technique in first picture and mouth to mouth ventilation in second picture. In this screen we can see in this picture head tilt and chin lift and mouth to mouth ventilation. In this video we can see the mouth to mouth ventilation. Pinch the nostrils closed with thumb, index finger and take deep breath, open mouth wide, place it outside of the victim mouth, making tight seal 2 full breaths to be given over the 1 second. In this video we can see tilt the victim's head back and lift the chin to open the airway. Here we can see in this video. These all are the clips in adult. Now we are seeing in children's. In children's we have to give with one hand. In infants we have to give with 2 fingers, index and middle finger we have to give a compressions. In adult 5 cm, children's 4 cm, neonate 3 cm. Till now we discussed related to the cardiopulmonary resuscitation, introduction and procedure, basics of first aid and first aid kit and guidelines, and when we have to stop it. CPR means guidelines to termination. These are the things we already discussed. Now moving on to today content, means today topic is first aid FAQs. Very important questions. First question, how long should you check for breathing while performing CPR? Options, option A 5 seconds, option B do not check for breathing, continue chest compressions, option C 2 seconds, option D no longer than 10 seconds. Listen over their mouth and nose for breathing sounds. Feel their breath against your cheek for 10 seconds. Simultaneously check the cardiac pulse for a minimum of 5 seconds, not more than 5 seconds. We have to check carotid pulse minimum within 5 seconds only to determine if there is a pulse present or not. No pulse, immediately we have to start CPR. So here option D no longer than 10 seconds is the correct answer. Chest compression to be followed 30 compressions and 2 rescue breaths. How long should you check for breathing while performing CPR means option D here no longer than 10 seconds is the correct answer. Next we will move on to question number 2. Where should you place the AED pads when treating an infant for pediatric cardiac arrest? Here the infant is in cardiac arrest where we have to place a AED pads. Here, what is AED? AED means automated external defibrillators. Automated external defibrillator is a medical device designed to analyze the heart rhythm and deliver an electric shock to victims of ventricular fibrillation to restore the heart rhythm to normal. So here we will see options first. Option A, do not use an AED on an infant. Option B, chest and back. Option C, upper chest and mild abdomen. Option D, none of the above. In infants, AED pads we have to apply. First pad apply on the front of the chest and second AED pad to be applied at back. In adults, both pads should be placed on the front of the chest with one pad above the nipple and other pad placed on the left side below the chest. So here in infants, the AED pad should be placed in chest and back. Option B is the correct answer here. Next we will move on to question number 3. What is the most effective way to stop major bleeding? Here the person or victim is having major bleeding. The most effective way to stop major bleeding. We will see here options. Option A, elevation. Option B, indirect pressure. Option C, direct pressure. And option D, irrigation with normal saline. Stop bleeding by direct putting pressure on the area with a tissue gauze pad or a clean cloth. The bleeding should stop after few minutes, then remove hand and otherwise add more gauze or another cloth. Apply more pressure by direct. Here, direct pressure over the bleeding point is most effective way to stop major bleeding. So here option C, direct pressure is the correct answer. Most effective way to stop major bleeding is option C is the correct answer. Next we will move on to question number 4. What does DRAB, D-R-A-B stands for? DRAB stands for. We will see here options. Option A, danger, response, airway, bleeding. Option B, danger, review, airway, bleeding. Option C, danger, response, airway, breathing. Option D, danger, review, airway, breathing. Here DRAB means we are having 5 elements of primary survey. Step 1, we will see one by one. We are having 5 steps. First step is danger. To assess the situation for any danger. This is first step is danger. Second step is response. Check the victims any response is there or not. And third step is airway. We have to provide airway. There is no response. We have to give a airway. This is the third step. And fourth step is breathing. We have to assess for breathing. The fifth step is circulation. So here DRAB means danger, response, airway, breathing. Option C is the correct answer here. Next we will move on to question number 5. What is anaphylaxis? What is the anaphylaxis? We will see here options. Option A, a mild allergic reaction. Option B, severe life-threatening allergic reaction. Option C, serious form of infection. Option D, serious lung infection. Anaphylaxis is a life-threatening whole-body allergic reaction. It requires immediate treatment to save the victim's life. Anaphylaxis is a result of body's immune system overacting to a harmless substances such as food. The signs and symptoms of anaphylaxis is red rashes, swollen throat, wheezing, fast heartbeat, breathing difficulty or SOB, shortness of breath, confusion and anxiety. The treatment of anaphylaxis means the first aid. Treatment is immediate medical attention and should call 911 number for help. So here anaphylaxis means severe life-threatening allergic reaction. Option B is the correct answer here. Next we will move on to question number 6. What speed of chest compression should you aim for? Means the speed of chest compressions which aim we are following. Option A, 110 to 120 chest compressions per minute. Option B, 100 chest compressions per minute. Option C, 100 to 120 chest compressions per minute. Option D, 80 to 100 chest compressions per minute. This is the current recommended speed of chest compressions. Place the heel of your hand on the center of person's chest, then place the palm of your other hand on top or press down by 5 to 6 centimeters or 2 to 2.5 inches at a steady rate of 100 to 120 compressions per minute. So here the speed of chest compression should you aim for 100 to 120 chest compressions per minute. Option C is the correct answer here. Next we will move on to question number 7. In which situation would you wrap a casualty in a cold wet sheet? In which situation would you wrap a casualty in a cold and wet sheet? We will see here option. Option A stroke, option B brain stroke, option C heart stroke, option D heat stroke. In heat stroke, the situation would you wrap a casualty in cold wet sheet? So here option D is the correct answer. Move them to a cool place, call 999, wrap in a cool wet sheet until temperature reduces 37.5 degrees Celsius. There is a quick test anyone can do if you think someone is having a stroke. It is called as fast test also. We can do a quick test in the heat stroke patients. We have to wrap a casualty in a cold and wet sheet is option D heat stroke condition. We are following the process of wrapping casualty in cold and wet sheet. Here option D is the correct answer. Next we will move on to question number 8. Which of the following is a way of checking if someone is breathing or not? So here which of the following way we have to check a breathing from the options. Now we will see here options. Option A feeling of breaths on chest. Option B listening near their mouth. Option C observe their chest is moving. Option D all of the above. Here look to see if their chest is rising and falling. Listen over their mouth and nose for breathing sounds. Feel their breathing against your cheek for 10 seconds, not more than 10 seconds. Simultaneously check carotid pulse for a 5 seconds. If there is no pulse, we have to start a CPR. So here the following is way of checking someone breathing is option B listening near their mouth. Option B is the correct answer. Next we will move on to question number 9. Chemical burns are caused by option A heat, option B acids, option C nitrogen gas, option D fire. Chemical burns are caused by strong acids, alkalis, drain cleaners and many other substances. People who work with chemicals for their job are more at risk of chemical burns. The first aid treatment for the chemical burns: wash away the chemical with water as quickly as possible, at least 3 to 5 minutes, and some chemicals may need 20 minutes of time for washing. Then gently remove any contaminated clothing from the area. Make sure protect yourself. Wear gloves if it is available. Then shift the casualty hospital. Observe closely and watch an airway and breathing of the victim. So here chemical burns are caused by option B acids is the correct answer here. Next we will move on to question number 10. 10th question is, which one is internationally accepted symbol for first aid? The first aid symbol accepted in internationally. We will see here options. Option A white cross and blue background. Option B white cross and red background. Option C white cross and green background. Option D none of the above. Here white cross and green background is the correct answer. White cross and green background is internationally accepted symbol for first aid by providing directions to available first aid care, tools or facilities. The purpose of first aid sign is to help preserve life, prevent medical conditions worsening, and promote recovery. So here in the internationally accepted symbol for the first aid is option C, white cross, and green background is the correct answer here. Next we will move on to question number 11. If a person has broken a bone, what should we have to do? Here in this person means the victim is have broken bone. The first aider have to do. We will see here options. Option A, keep the injury supported and still. Then option B, provide a some position and advise not move. Option C, use a splint to fix broken bone. Option D, call for help. Immobilization with a cast or splint heals most broken bones. However, they may need surgery to implant plates or rods. Maintain proper position. For maintaining purpose they need a surgery further management, that is, but here the first aider have to use a splint to fix a broken bone. Here option C is the correct answer. Maintain proper position of bones during healing. The treatment, the first aid treatment have to treat, stop any bleeding, apply pressure to the wound with sterile bandage, direct pressure with by the direct pressure, immobilize the injured area, apply ice packs to limit swelling and help to relieve a pain. Here option C, use a splint to fix a broken bone. Option C is the correct answer. Next we will move on to question number 12. How should you treat a minor burns? In the minor burns, how you will treat as a first aider? Now we will see options. Option A, ice. Option B, oil. Option C, ice water. Option D, soak the area with cool water. First degree burns is called as minor burns. Minor burns are very common and frequently occur accidentally with touches a hot stove and whirling iron or hair strainer. Minor burns are defined as first degree burns. So here the minor burns is also called as first degree burns. Before the discussion regarding question, we will discuss related to the classification of burns according to the degrees. We are having 4 degrees of burns. In first degree, burns is red, non-blister skin. In second degree burns, blisters and some thickening of skin. In third degree burns, widespread thickness with white. Lethargy also appears in third degree burns. So here in this question, the minor burns. Minor burns means first degree burns we will discuss now. Minor burns are defined as first degree burns and any second degree burns that extend over an area skin no longer than 3 inches. Do not use ice, butter, ice water, oil on a burn. These substances can damage the skin. Minor burns means we have to soak the area in cool water. Sunburn also be a first degree burn. As a first aider, we have to treat a primary first degree burn. Soak the area with cool water, cool the burn, apply antibiotic ointment and cover it with a sterile bandage. Observe any infection for further management, further medical attention to be done. Here option D is the correct answer. Next we will move on to question number 13. Which of the following are included in first aid kit? Option A, aspirin. Option B, hydrogen peroxide. Option C, bandages. Option D, gloves. And option E, all of the above. In first aid kit, related to the first aid kit common items and medication, we already discussed in introduction of this video. In first aid kit we are having thermometer, antiseptic solution, bandages. In medication, aspirin, and also common items like bandages, gloves, hydrogen peroxide. These all are the things comes under the equipments of first aid kit. So here all of the above option is the correct answer. Here aspirin we can use for heart attack symptoms like chest pain, and hydrogen peroxide we have to clean the wound. Any victim having any injury we have to clean the wound, and bandages we have to secure with sterile bandages, and gloves we have to wear gloves before contacting any blood liquids and blood products. So here option E is the correct answer. The first aid kit included all of the above. Next, move on to question number 14. If your co-worker suddenly unconscious, you are alone, which of the following you have to do? Here the co-worker is suddenly unconscious, you are alone. What you have to do? We will see here options. Option A, give rescue breaths. Option B, wait for emergency team to arrive. Option C, perform chest compressions. Option D, change position. If you are not trained in CPR, cardiopulmonary resuscitation, then provide hands only CPR. Means we have to perform chest compressions only. Here option C is the correct answer. Perform chest compressions only of about 100 chest compressions per minute until a paramedical team to be arrived. You don't need to try rescue breathing. Only you have to perform a chest compression. Next we will move on to question number 15. Which of the following is the most common symptom of heart attack? Here we will see here options. Option A, nausea. Option B, cough with vomiting. Option C, chest pain. Option D, shortness of breath. According to the Medicine Plus at the National Institute of Health, chest pain is the most common symptom of heart attack. Chest pain mainly present in only one part of the patient's body and radiates from chest to shoulder, arms, neck, jaw, belly or back. Most heart attacks involve discomfort in the chest center point and left side of the chest that lasts or more than few minutes. So here option C, chest pain is the most common symptom of heart attack. Option C is the correct answer here. Next we will move on to question number 16. In stroke, FAST stands for FAST stands for. We will see here options. Option A, face, arm, speech time. Option B, feet, arm, speech time. Option C, face, arm, speech technique. Option D, feet, arm, speech technique. Here FAST test is easy way to remember the warning sign of a stroke. FAST stands for facial drooping, arm weakness, speech difficulties and time. FAST FAST has been used by the National Stroke Association, American Heart Association and others to educate the public and detecting symptoms of a stroke. The signs and symptoms of stroke is numbness or weakness in the face, arms or leg. Means numbness, weakness in the face, arm or leg, confusion or trouble speaking, trouble walking, dizziness, severe headache. So here in stroke, FAST stands for face, arm, speech time. Means facial drooping, arm weakness, speech difficulties and time. Here option A is the correct answer. Next we will move on to question number 17. Which of the following is a symptom of heart stroke? We will see here option. Option A, high body temperature. Option B, rapid strong pulse. Option C, headache. Option D, hallucination. Option E, all of the above. Heart stroke is the most serious heat related illness, sometimes called as hyperthermia. Hyperthermia. Heart stroke is sometimes called as hyperthermia. Heart stroke is a condition characterized by overheating of body, usually resulting of prolonged exposure to high temperature. Next move on to question number 17. Which of the following is a symptoms of heart? This is not heart stroke friends, here heat stroke. By mistakenly typing error is done here. Heat stroke. We will see here options. Option A, high body temperature. Option B, rapid strong pulse. Option C, headache. Option D, hallucinations. And option E, all of the above. Heat stroke is the most serious heat related illness, sometimes called as hyperthermia. Heat stroke is a condition characterized by overheating of body, usually results of prolonged exposure to high temperature. The signs and symptoms for the heat stroke: confusion, altered mental status, loss of consciousness, and dry skin or profuse sweating, seizures, very high temperature. These all are the signs and symptoms of the heat stroke. The first aider have to do in this situation to provide cool area and put the person in a cool shower or in a tub, sponge the person with cool water, switch on the fan in the room, cover the person with cool damp sheet. So here the signs and symptoms of heat stroke is high body temperature, rapid strong pulse and headache, hallucination and confusion, seizures. So here all of the above is the correct answer. Next we will move on to question number 18. Which of the following is not the purpose of a first aid? From the option 1 is the not a purpose of first aid. We will see here option A, to prevent complications. Option B, to preserve life. Option C, promote recovery. Option D, to protect wound areas. In the first aid we are having three purposes, means 3 P's of first aid. Here first one is to preserve life and to prevent complications and promote recovery. The role of the first aid to help given to a someone who is injured or ill, to keep them safe and to cause no further harm, and prevention of illness or injury is the main purpose of first aid. So here option D is not a purpose of first aid. Option D, to protect wound area, is not a purpose of first aid. So here option D is the except here. Next we will move on to question number 19. How long should press a injured area to stop bleeding? How long we have to press a injured area for a stop a bleeding? We will see here options. Option A, 15 minutes. Option B, 5 minutes. Option C, until help arrive. Option D, none of the above. If the cut is a small, wash it out with a soap and water. After putting on clean gloves, apply firm pressure to the wound with a folded cloth or bandage for about 10 minutes. Direct pressure and elevate the area for a full of 15 minutes. Then to see whether bleeding has stopped or not. So here option A, 15 minutes have to press the injured area for a stop a bleeding purpose. So here option A is the correct answer. Next we will move on to question number 20. Purpose of wearing a dressing. What is the purpose of wearing a dressing? We will see here options. Option A, to prevent internal bleeding. Option B, avoid spreading infection. Option C, to reduce the risk of infection. Here the purpose of wearing a dressing is used to protect a wound and prevent infection, but also allow healing. A dressing should be large enough to totally cover the wound with a safety margin of about 2.5 centimeters on all sides beyond the wound. The purpose of wearing dressing is covering a break in the skin, help to control bleeding and protect against the infection and promote wound healing. So here option C, to reduce the risk of infection, is the correct answer. Here I want to clear one thing, friends. Here prevent internal bleeding and avoid spreading infection is the aims. These are the aims for the wearing dressing, not purpose. The purpose here option C, to reduce a risk of infection. Next we will move on to question number 21. What is the main purpose of Hilmlich maneuver? Hilmlich means H-E-I-M-L-I-C-H. This is H-I-L, but here Hilmlich means H-E-L-M-L-I-C-H. Hilmlich maneuver. What is the purpose of Hilmlich maneuver? We will see here option. Option A, to treat absence of a victim's breathing. Option B, to treat insufficient breathing. Option C, to remove A blocking in the victim's airway. Option D, all of the above. Here, abdominal thrust also known as the Hilmlich maneuver. So here abdominal thrust method. Hilmlich maneuver is a first aid procedure used to treat upper airway obstruction by foreign body or foreign objectives. Hilmlich maneuver is the manual application of sudden upward pressure on the upper abdomen of the choking a victim to force a foreign object from the trachea. So here option C, to remove a blocking in the victim's airway, main purpose of the Hilmlich maneuver. Here option C is the correct answer. Use this method only in adults. A different technique is used in infants and children. So here option C is the correct answer. Next we will move on to question number 22. What are the symptoms of hypothermia? What are the symptoms of hypothermia? We will see here options. Option A, warm and sweaty. Option B, just sweaty. Option C, cold, tired, shivering and acting abnormally. Option D, cold, sweaty. Here, a significant and potentially dangerous drops in body temperature. The most common cause is prolonged exposure to cold. Hypothermia is prolonged exposure of cold. Due to this, the decreased body temperature is a danger drop in body temperature. The first aid treatment for the hypothermia: move somewhere in the warm place, replace wet cloths, wrap in blankets, give them a warm drinks, apply a compress only to the neck, chest wall or groin. Do not apply a warm compress to the arms and legs. So here the symptoms of hypothermia is cold, tired, shivering and acting abnormally. Here option C is the correct answer. The hypothermia client or victim will feel cold, tired, shivering and acting abnormally. Next we will move on to question number 23. How can you recognize a vein bleeding? How can you recognize a bleeding from the vein? We will see here options. Option A, blood flows rapidly out of the wound. Option B, blood flows equally out of the wound. Option C, blood flows slowly out of the wound. Option D, none of the above. As the blood is coming from a vein, it is a dark red because it does not contain a much oxygen. Also because veins are not under direct pressure, the blood flows steadily but comes out less forcefully than it does with arterial bleeding. The first aid treatment have to apply direct pressure to the bleeding wound or bleeding area. Here, recognition a vein bleeding is blood flows equally out of the wound. Option B is the correct answer here. Next, we will move on to question number 24. A nosebleed can be stopped by. Here we will see the options. Option A, wait for some time. Option B, pinching the nostrils. Option C, drink something cold. Option D, press with some cotton. Pinching puts pressure on the blood vessels and helps stop the bleed and blood flow. If the bleeding does not stop, pinch the nose again for up to 15 minutes. Do not let go for at least 5 minutes. Even to check if the bleeding has stopped, seek emergency care for further management. And first aid treatment to be done for nose bleeding cases. Pinch the entire soft part of the nostrils and lean forward. Breathing should be taken through the mouth. Hold same position for 5 minutes. This process we have to follow during the nose bleeding. So here a nose bleed can be stopped by pinching nostrils. Option B, pinching the nostrils is the correct answer here. Next we will move on to question number 25. Which age group having the highest risk of burns? Which age group is having high risk of burns? We will see here option. Option A, 4 years to 7 years age. Option B, 6 months to 2 years of age. Option C, 50 to 65 years of age. And option D, adults. Children aged 6 months through 2 years accounted for 88% of all cases and were 7 times more likely to be hospitalized for a burn injury than were children outside this age range. Greatest number of pediatric burns patients are infants and toddlers younger than 3 years of age burned by scalding liquids. So here the age group is having highest risk of burns is option B. 6 months to 2 years of age is the correct answer here. Next we will move on to question number 26. Best way to check a patient's circulation from following options. Option A, check temperature. Option B, check respiration. Option C, check for noise, breathing. Option D, none of the above. The best way to check patient circulation through the check for noise and breathing. Noisy breathing is typically characterized by a partial blockage or narrowing at some point in the airways, means respiratory tract. So the best way to check patient circulation through the check for noisy breathing or eye movement. So here option C is the correct answer. Next we will move on to question number 27. What should you do if you feel a rib break when performing chest compression? While giving a CPR chest compression, the rib is fractured. What you will do in this situation? We will see here option. Option A, stop CPR immediately. Option B, only rescue breaths to be continued. Option C, slow down chest compressions. Option D, check a rib break is present or not. If you are performing CPR and hear or feel rib break, you should keep going because over 50% of victims who are undergone CPR will have broken ribs. Do not let them put you off delivering effective chest compressions because we have to give a chest compressions continuously because we have to survive the patient or victim condition. Of course, the victim chest will hurt when they wake up, but one thing is not a matter because that they are alive after the CPR. So here option C, slow down chest compressions. We have to continue the chest compression, but we have to give a slow down. We have to give a slow down chest compressions. Option C is the correct answer here. Next we will move on to question number 28. What is shock in first aid? What is the shock in first aid? We will see here option. Option A, that body temperature drops too low. Option B, lack of oxygen reaching to the cells and tissues in the body. Option C, hypoglycemic state. Option D, emotional imbalance. Shock will occur when the body cells do not receive an adequate supply of oxygen. Shock occurs when a victim loses too much of blood or any life-threatening allergic reactions, for example anaphylaxis. When a person is in shock, his or her organs are not getting enough blood or oxygen, they will undergo shock. Shock may result from a trauma, stroke, blood loss, and allergic reaction, severe infection and poisoning, severe burns. These all are the things due to the lack of oxygen reaching the cells and tissues in the body. So here option B is the correct answer. Next we will move on to question number 29. In an emergency situation, who is the most important person? We'll see here options. Option A, injured victim. Option B, yourself. Option C, bystanders. Option D, none of the above. Main principle of incident management is that you are the most important person in and your safety comes first. Your first action when coming across the scene of an incident should be check for any dangers to yourself or bystanders. Manage any dangers are found. You have to take your safety first. Here what is the meaning of bystanders? Bystanders means a person who is standing near and sees something that happens without being involved in the procedure. So here yourself is the correct answer. The emergency situation, the most important person is yourself. Option B is the correct answer here. Next we will move on to question number 30. This is the last question in this video. After someone has fainted, what position should they be in to aid recovery? So here the position for the fainted patient, which position we have to give for recovery. We will see here option A, sit in chair, option B, lay flat, option C, lay down with legs raised, option D, stand upright. Here fainted, what is meaning of fainting? Fainting means a sudden temporary loss of unconscious. Most common reason, sudden drop in blood pressure which reduce blood flow and oxygen to the brain. So here lay down with legs raised is best position to recover the fainting condition. Benefits for the lay down with legs raised position. Benefits includes improved blood flow, reduces the inflammation and lower pressure in the veins in the legs. So here the best treatment and best position should they have to be in aid recovery is option C, lay down with legs raised position is the correct answer here. This is the last question in this video. We will continue further questions in the further videos. We will continue from the question number 31st to in part 2 video. This is part 1 regarding first aid and management related to the emergencies. Thank you so much for watching, and anybody watching first time my channel, please subscribe my channel, like the video and share the video. Please drop your opinion in the comment section. Click on the bell icon for further notification. Stay tuned friends.